Hi there, I'm David Gregory, getting ready for Meet the Press on Sunday, covering this health care debate. I mean, you've been watching these town halls around the country and how much anger there is toward the government, toward the administration for pursuing this health care reform. But let me give you some sense of what's been going on inside the Beltway while everybody else is on vacation, because there's a lot going on. I've been talking to senators on both sides of the aisle who make it very clear now, especially those closest to the White House, that they feel like health care is in deep, deep trouble. And a lot of these people are saying, look, the president himself now has to ramp it up. He's got to speak about this in a more personal way, in more moral terms for the country. He's got to do something to get away from the fact that the debate is being defined by death panels and the idea that big government is going to take over the health care system. So that's the advice that the president's getting, and you're seeing some of that in terms of the president trying to reframe the terms of the debate. There's also a political reality, speaking to even some Democrats who say that the president has a real big problem with independent voters now in parts of the country that were crucial for his election last year. These are people who are deeply skeptical about this health care reform effort, what it means to them if they have insurance, and all of this government programming to the tune of at least $1 trillion, even though that's over 10 years. The point is it's so very, very expensive. And people wondering, why do this now when the economy is in this shape, and can the country really afford it? You think about the government involved in bailouts of the banks, of GM and Chrysler, and then having a major intrusion into the health care system as well. For a lot of people, it's just way too much. They don't think that the government can manage it. So these are some of the things that the president's hearing about right now. There's lots of strategy that you can talk about in terms of what could happen inside Congress. But the reality that a lot of Democrats are starting to face is that the Republicans are gone. The idea of a grand bargain with the Republicans may be gone, and that they might have to do this as a Democratic-only bill. The president today said that he thinks a lot of Republicans are starting to retreat to that mindset that they had back in 1993-94, which is if we can stop the president on this, we can make up a lot of ground in an election, the midterm elections next year. And indeed, even the likes of former President Clinton have expressed that view as well, that if President Obama does not get health care this go-around, it's going to have profound implications for Democrats next year at the polls. So we're going to get into all of this on Sunday. We will have the health care debate and what comes next and what's in it for you when we see two key finance members in the Senate square off, Senator Hatch and Senator Schumer. And also the latest on Afghanistan and the key question, are we winning over there after the elections this week? We'll have the chairman of the Joint Chiefs of Staff, Admiral Mike Mullen, who will take us through what the goals are in Afghanistan and whether the U.S. is prevailing.